Fantastic, good. So we're starting with mobilization. What do you think would be the effect of mobilization? Or what actually you mobilize?
Joints.
Joints, yeah.
Mm. Help them get more movement if
Yeah.
it's stiff.
So you improve the movement?
Yeah.
Yeah.
Especially if they're arthritic, is that right?
Yes. So which arthritis, do you remember?
Osteoarthritis.
Osteoarthritis. Yeah. Where the cartilage kind of run and you want to just maybe give a nice traction and move them a little bit, yeah? What else?
Helping to stretch the surrounding muscles.
Yeah, fantastic, isn't it?
Yeah.
Because with the joint you stretch the muscles as well. You can improve blood circulation because of that. And also you can relax them. You know, it's almost like I take over and I allow you to move now better, and it will have a good effect on the, which one, the sympathetic or the parasympathetic?
Parasympathetic.
Good. So let's start by doing the shoulder joint. Actually, it's not the shoulder joint, but if you come closer, yeah, it's the shoulder complex that I'm looking for. Now, what is the difference? The shoulder joint mobilization would be to mobilize that. Do you see? This is the shoulder joint movement. Now, so it's in between the scapula and the humerus. Yeah? Now, what I'm going to do is a combination of moving that, but also moving the scapula. Yeah? Do you understand that? Yeah? Now, from those, I actually pay attention to both of them. Yeah? Because I don't want to use only one mobilization of the shoulder joint, but also moving the scapula. Now, the scapula is very interesting because it's a suspended bone that has only one attachment in front to the rest of the skeleton. And it's actually kind of suspend on muscles. So we have the rhomboids here that attach the scapula to the spine. We have the latissimus dorsi. We have the trapezius. We have deltoid. They all attach to the scapula.
Infraspinatus.
Infraspinatus, supraspinatus, teres major and minor, and another muscle that is not required, subscapularis, and yeah, so a lot of muscle that attach. Now, how do you contract this muscle would move the scapula? So if we'll ask Gary to contract, or let's ask yourself to contract the trapezius, and what you do is that. Can you contract now the latissimus dorsi? You would do that to, yeah, drag that. And you can check, put your hand in here, and do you feel it?
Yeah.
Yeah, when you depress your shoulder down, this muscle should be more activated, yeah? So, okay. So now, I'm going to show you just the holding now, which is quite difficult, and then after that, we'll take it a notch up and we'll actually do the mobilization itself. Yeah? So, you suspend the hand this way, you come and actually attach it onto your outside of your leg. There are a few variations I'll show you, and then you just move yourself. Okay?
Sorry, can I ask a question?
Ask one after, okay? You want to stretch it, you go that way, okay? Okay. Another variation is that you can put their hand there, underneath, and then you move it. But this way, his hand is dragging on the, and it can be kind of annoying, so you can just drop it and do that. So there is a small combination. You can put your hand in here. You can bend your leg a little bit. And what you need to know is that you need to fix the hand into your body. Without it, it's going to be wobbly, and they will start to contract the muscles because they're not feeling very confident,
Comfortable.
you know, comfortable,
Secure.
supported, secure. Yeah, secure is the good word, I think. And then they will start to contract their muscles and not good. Okay. Okay, good. Now, I'll ask Gary to turn around, please, on your back, this way. Yeah, good. Now, we'll do it facing up. Come a little, shove yourself down a little bit. And you see that facing up, the supine position is a lot easier because now the hand can go up. So the arm can go up, and you don't need to go down so much. So I'll show you what's called the three-point hold position. So first hold is his arm onto your side of the body. The second one is your hand on top of it. That should be enough. Now what's the problem usually? That you're using so much force that I see students kind of doing that. It's hard. It's like playing the Scottish flute, you know, but that you need to have some force, but you can't do it too much. So you need to find the right balance of it. Yeah, their elbow should be a little bit bendy, because if not, you would feel that the hand becomes very tighter, the whole arm becomes tighter. So what do? I just bend myself like that. Okay, so these are the 2 points. The third point is here. And then you have a free hand, but we'll talk about this free hand soon. Now I want you to just feel that you can move. You can move in here. Even stretch it this way. Now I'll ask Gary, how is it if I do it this way?
Feels dragging.
Sorry? It feels dragging.
Yeah.
Yeah. So if you have a surface, a contact surface, you try to maximize it so there is no drag on one area. If I'll do it just with 2 fingers, it's going to be hurt. It's going to be painful. So you try to do the 3 points to allow yourself a better fitness. So don't force your hand too much into the flesh here, this hand, yeah? But be gentle here and more on there. Now, it's not the technique that you're going to do for an hour, so be sure, you know, that you use your body correctly. Okay? That's it to start with, really. Yeah? After that, we'll add on. Questions?
When you're going close to the bed, are you pushing down, or are you
When
when you're moving the arm back towards the body, are you going in a downward motion, or are you going
I push it
Just
toward the direction.
up, not into the bed?
No,
Yeah.
no.
So as if
I
it's
do
going
actually
across.
that, not
Okay.
that.
Yeah.
I could push it backward, but that would be taken care after. Yeah. Now we're looking more at this
Just moving.
forward, downward, upward. Because of the constraint, you can't push it
Yeah.
into bed because the bed is there.
Yeah.
Yeah. Hassan? question?
Sorry, just to double check. So the direction that the force is towards Gary.
And away.
Okay. Yeah,
I would let you try to see the force direction, the vector, the direction to where you're going is very important and might change from person to person. And this is what I want you to experiment, to try, to see how does it feel, yeah? And also think about muscles, you know. Which muscle do I stretch now?
Trapeze.
Which muscle I could stretch now?
Pectoral.
Yeah? So where does it connect it to? Okay? It's all revision for the anatomy. Yeah? I'll go around and help you with, but shall we start? Yeah?
Just
Yep.
one
You can
question.
close that.